afternoon, everyone, and thank you so much for coming. My name is Tammy Lewis. I am a professor of sociology, and I am also the director of the TAO Mentoring Initiative. Welcome to the TAO Mentor in Residence inaugural address. Before we get to our speaker this afternoon, I would like to say a few things about our initiative. We received a generous grant from the TAO Foundation, which is enabling Brooklyn College to intentionally focus on generating a culture of mentorship. The TAO Mentoring Initiative has 5 parts, and the TAO Mentor in Residence program is one of these parts. And our event today with Mr. Sam Schwartz is our very first event. So welcome, thank you for coming, and let's have a hand of applause for the TAOs and for Mr. Schwartz. So what we're doing with the TAO Mentor in Residence program is we are bringing high-profile senior scholars and practitioners to Brooklyn College to engage with students and faculty over the course of a semester. Mentors in residence like Mr. Sam Schwartz are outstanding leaders, not just in one field, but across various fields. And they really are interdisciplinary kinds of thinkers. And in addition to his talk today, Mr. Schwartz, as our first mentor in residence, is going to come to different classes to give guest lectures. He's going to meet with faculty who are interested in his area of research. He's going to meet with students one-on-one, in person, and via Zoom. And because I know some of our students can be a little bit shy, and I'm looking at some of you who I know, you can also sign up to meet with him in a group to make it less intimidating. So we are going to pass around a sign-up sheet for a meeting with Mr. Schwartz. We have some times planned for the next few weeks, but if those times don't work for you, you could just sign up and we will contact you by email to set something up for you. After our speech today, we are going to go next door to the Kimmick Reading Room where we will have a little reception and you'll get to meet Mr. Schwartz. And I'm not actually going to give you his bio because Dean Tolius is going to do that. But I do want to say to you that one of the overarching goals in the TAO Mentoring Initiative is for every student on Brooklyn College's campus to have a transformational experience. And I think it's so great that Mr. Schwartz is our first speaker because he is an alum from 1969 and he credits Brooklyn College with much of his success. He had a transformational experience here. And at lunch today, I also got to learn that not only did he have a transformational experience here, but so did his brother, so did his wife, and so did other members of his family who went to City College and other CUNY campuses. So I think he is an exemplar of what we hope to produce through the TAO Mentoring program. So let me now introduce Dean Tolius from the School of Natural and Behavioral Sciences, who will tell you a little bit about our guest today. Peter?
Good afternoon, everyone. And it's a pleasure today for me to introduce Samuel Schwartz for today's keynote address in this TAO Mentor in Residence program. Mr. Schwartz obtained his bachelor's degree in physics here at Brooklyn College, as you just heard, in 1969, and later received a Master of Science degree in civil engineering at UPenn. And he is a licensed professional engineer. He is founder of Sam Schwartz Engineering, an international urban planning and engineering firm, and is currently CEO of Sam Schwartz Pedestrian Traffic Management Services, a firm that provides personnel to management, both traffic and pedestrian crowds around New York City and in several other states. He also writes a column on traffic for the New York Daily News. Previously, Mr. Schwartz was New York City's traffic commissioner and was chief of engineering for the New York City Department of Transportation. He started his transportation career in the late 60s as an NYC cabbie and joined the traffic department as a junior engineer in 1971. Mr. Schwartz has written several books. His most recent books, No One at the Wheel, Driverless Cars on the Road of the Future, published in 2018, and in 2015, previous to that, Street Smart, The Rise of Cities and the Fall of Cars. These books lay a recipe for cities faced with rapid changes in modes, automation, demographic shifts, and travelers' preferences. Mr. Schwartz specializes in creative problem solving for seemingly intractable situations. He is an expert at getting people out of their cars and into other forms of transportation. He also is proficient at moving these people who remain in their cars more swiftly and safely. Mr. Schwartz has created many win-win situations whereby traffic moves better, pedestrians are safer, and the community gains more sidewalk and green spaces. He's been called an urban alchemist for making grass grow from asphalt. Mr. Schwartz, often referred to as Gridlock Sam, and released the word gridlock into the lexicon during the 1980 New York City transit strike. Thank you for that word. It actually gets used outside of this context, obviously. Mr. Schwartz has been an adjunct professor for over 40 years at some of New York City's most respected colleges and universities, including Cooper Union, Long Island University, Hunter College, and of course, Brooklyn College. He is on the boards of International Professional Association for Transport and Health, Regional Plan Association, and NYU's Institute of Design and Construction. He is also active in community affairs and has helped found 2 New York City public schools, a school for the physical city and the Metropolitan Expeditionary Learning School. So without further ado, let's have a warm welcome from Mr. Samuel Schwartz.
Thank you. Thank you, Dean, for that introduction. And Tammy was talking about the cross-disciplinary experiences that I've had, which is really important for all of you to think about, that you don't need to be pigeonholed in one area versus another area. You can cross boundaries. And today's talk was sparked by me crossing boundaries. When I first gave this talk, I was invited to grand rounds at Mount Sinai Hospital in Manhattan. And Mount Sinai Hospital saw a connection between transportation and public health. So here's a physics major engineer talking to doctors, public health officials, and others. So you're going to get a bit of that presentation here today. Transportation and public health inextricably linked, for better and too often for worse. And this is the agenda for today, and I'm going to cover a couple of topics that you've heard about or you're hearing about in the news that are very relevant. The first, I'll talk a little bit about my education, how I saw the connection between transportation and public health, a little history on how we got here, where we are today in cities, how bad transportation policy increases disease and inequity, and the corollary to that is true as well. Good transportation policies can reduce disease and reduce inequity. A lot of research on COVID-19 and transportation, a lot of eye-opening research. Congestion pricing, which is in the news almost every day, and I'll talk about that. I've only been working on that for a half century now. Autonomous vehicles and the future of transportation. As you heard the Dean mention, I wrote a book on autonomous vehicles and rethinking our streets and land use. So my education came about when I was traffic commissioner, and an ER doctor from Cornell on the Upper East Side said, when pedestrians are coming into, after being struck by cars, he's been noticing a change. And that change was, in the past, it was largely leg injuries, lower extremity injuries. Now they were having chest and head injuries. And he associated that with the height of cars. That was my first experience with it. And indeed, the statistics have been sadly upheld over the years. As cars got taller, as cars got heavier, pedestrian fatalities have increased. The second was I was a guest speaker at an event at the Chicago Metropolitan Planning Council, and the co-chair of the Planning Council was a pediatrician. And I asked him, how come he was on the Planning Council, because we didn't see many medical doctors on planning councils. And he said, I'm really tired of seeing my children being brought in after being struck by cars. So he saw an association to it. The third was about 10 years ago when I saw this map, and there are plenty of other maps, but this is a map from around 10 years ago of the city of Toronto. And what they found is a number of diseases seemed to correlate where people lived. And it wasn't because necessarily emissions or near power plants. They found that those communities where people walked more or took transit more had lower incidence of diabetes, for example, and lower incidence of certain cancers and other kinds of things. So the form of a city has an effect on the health of a city. And some of the bad transportation policies, some are very obvious. The air pollution, the noise pollution is really quite serious, and it's often underlooked, but a number of studies have shown noise pollution not only increases your blood pressure and causes other kinds of diseases, it affects learning. Children that live near very noisy areas, all things held constant, don't do as well. Of course, traffic crashes, lack of access to health care, to jobs, to green space, and an everybody drives planning policy, which means those that don't drive are forgotten about. And those are often people with disabilities. They are low-income people that can't afford cars, often people of color, elderly people. But if we design our cities for driving, we forget about a whole class of people. And last, but certainly not the least, and there's a much longer list than this, it's accelerating climate change. And the kinds of diseases, respiratory diseases like you would expect, cardiovascular disease, inactivity diseases, and some cancers. And those cancers are often the result of inactivity diseases. So you find a correlation between some cancers and the amount of walking people are doing, or the amount of physical exercise that they get, because their immune systems aren't quite as strong to fight off cancers. Injuries and death, of course, from crashes. Mental health impacts are now being studied as well, and inequality. So how did we get here? I like to talk about a city like New York as going through three phases. The first phase is we walked everywhere, when we wanted to walk, where we wanted to walk, in a direct line. And then suddenly we got interrupted by cars, and we had to walk at right angles, and we created something called jaywalking, whereas humanoids upright walked for millions of years without in direct lines. Then we became a tract city, mid-19th to mid-20th century, and then we tried to adapt the city for cars. And we were having a very earlier discussion with Sophia about dealing with the car itself, but also you can't just deal with the car, that's one approach, but you also have to deal with society and how it's impacted society on it. This is just a little bit of what New York City lost. And this goes for many streets here in Brooklyn, what New York City lost. The first on the left is Fifth Avenue. Back in the around 1909, 1910, we had very wide sidewalks. And then suddenly there was this modernist movement that a city had to be made for cars, and we narrowed the sidewalks and we added car lanes. Park Avenue, you may wonder, why was it called Park Avenue? It was a park. It was a park in the middle of Midtown Manhattan. Look at that gorgeous park. Someday I'm going to colorize it so it'll be green. But we gave up that park and we just had little at this time we had little carriage roads on either side. Then we put 4 car lanes on either side to modernize the city. And I love this last slide about the Brooklyn Bridge modernization. And you see I'm always putting quotes on the modernization. Before the bridge was modernized, it had 4 tracks going across. Pedestrians would walk across, outside carriage or later car lanes on it. In 1907, the Brooklyn Bridge carried 426,000 people a day. Then we modernized it, and it carries 200,000 people a day. So much for modernization, because we replaced the tracks with car lanes, which are incredibly inefficient, but some of you may have taken a bike across the Brooklyn Bridge, and you see now there is a bicycle lane, and 1 car lane has been taken away. I am hoping to restore Fifth Avenue. I'm working on that right now. I hope to restore Park Avenue. But these things will take decades, so I'm going to need you guys out there to follow through on this. And how did all this happen? You may have heard about Robert Moses. A very good book to read is The Power Broker, but I wouldn't say that's the only book to read on Robert Moses. Moses did a lot of good things for the city, but also did a lot of pretty terrible things for the city. And one was he bought into this highways over people. And there's a picture of him. When you operate in an overbuilt metropolis, you have to hack your way with a meat axe. Modern highway standards require wide lanes, wide shoulders, and buffers. And you could see what that empty void there, which looks like a bombed out area, was where people lived for miles. People lived there. He barreled right through people's homes. And that kind of created the South Bronx, which is now the poorest congressional district in the country, according to its current congressperson. So we bought into that, even here in New York City. Now, the connection to health, air pollution, particularly particulates from trucks, are very harmful. Little particles, 2.5 microns. They get into the lungs and they're not expelled like many gases. 17% of all PM 2.5 emissions come from traffic, and it contributes to thousands of deaths every single year. And it's higher in high poverty areas relative to low poverty areas, and it involves in about 3% of hospitalizations for respiratory or cardiovascular illnesses. For greenhouses, the transportation sector, which includes aviation, is the single biggest sector for greenhouse gases. So if we're going to take care of this planet and change some of the climate strategies, we're going to need to work on changing how we move about. The noise, of course, by the airports, the noise is the highest, but this, you could see the purple areas, the highest noise areas are those areas near expressways, near there are trucks. And the people that live near the expressways all too often are low-income people, people of color. And you could see how high it gets almost to an aircraft at takeoff. This is really an awful story, and we did get better over decades. From the 1960s, when I graduated Brooklyn College, there was a book written, I believe it was 1966, Unsafe at Any Speed by Ralph Nader, and that transformed the auto industry, kicking and screaming, but making cars a lot safer. And deaths went down for the next 30 years. And then sometime around 2005, 2010, they started to climb back up, particularly among pedestrians. And if you look at the curve over those years, you could see the size and height of the vehicle corresponds to the increase in pedestrian casualties on it. So this is pretty bad news, and it continued during the COVID period, traffic fatalities in the US increased by 9% in 2021 compared to 2020. I was just looking at some data from Europe, and I thought, well, maybe this is, humans have this experience. COVID somehow changed our mental state, and we're driving more recklessly. Well, that would happen in Europe too, but traffic fatalities went down in Europe during the same period. I haven't figured out what they do differently yet, but this is bad news for the United States and bad news for places like New York City. As far as pedestrians being hit by cars, you could see it correlates, unfortunately, with the lower income areas and, again, communities of color. In Brooklyn, not far from Brooklyn College, you could see some very high density areas. You could see the South Bronx being a high area, Jamaica and other areas in Queens, and the northern parts of Staten Island. So it's not, an accident is not being used by professionals anymore because it's not accidental. It's happening for a reason, so we call it crashes. And equity is also connected to all this. 3.6 million people in the United States don't get medical care due to transportation barriers. And it's one of the largest barriers to accessing health services for older adults. If you take a look at the bars on the right, those are studies done by the Transit Center. And if you're going to urgent care, you have an urgent care issue, it takes you 33 minutes by transit on average, or 12 minutes by car. Car is 21 minutes faster. That could be pretty important in a serious event. In terms of getting to the hospital, 9 minutes by car, 25 minutes by transit. And that could be life and death differences. This next segment, I'm going to talk about COVID-19 and transit and transportation and the impact. And it's having an impact on cities that is going to be broad. It's already being felt, but it will be broadly felt for the next decade and may shape things to come going forward. And again, I presented this to the medical community, and this is work that we did pro bono when COVID hit. Work at my company was hit back in March of 2020, and we decided to do a fair amount of pro bono work. And one of the things that we did was look at COVID's impact on transportation. Report was released in September 2020, so it was in the early part of the pandemic, and what I'm about to show you, much of it has been supported by later studies. But what sparked this is that there were lots of articles that came out at that time saying the subways seeded the massive coronavirus epidemic in New York City. Well, it came out of MIT. Well, if MIT says so, it's got to be true. And Wall Street Journal said public transit use is associated with higher coronavirus death rates. The New York Times even went so far as to saying, well, maybe the car is saving Los Angeles. So maybe we made a mistake in New York by having so much transit, whereas LA, everybody drives, which not everybody drives, but you know what I mean. But I was bothered by that because it didn't seem to be supported by the statistics that we were looking at. So with this small team, we looked at confirmed COVID-19 cases during the peak of the pandemic. And we located them by zones. And we also looked at public transit usage and car availability and income levels. And we found some things that didn't seem to support what we were being told, that the subways were what's contributing to COVID. The 10 highest transit usage zones, and we excluded Manhattan at the time because you may remember there was a mass exodus out of Manhattan of the well-to-do. So we felt that that might skew some of the results here. And this is from February 29th to January 10th, 2020, the real peak, awful time. I assume most of you were in New York at that time. You know we were the epicenter of the world in terms of COVID. The 10 highest transit usage zones had a 31% lower case rate than the 10 lowest zones. So if transit was contributing to it, wouldn't we have seen that? Staten Island, which has no subways, had a 50% higher rate than Manhattan and had a 28% higher rate than Brooklyn. That's odd, they don't have subways. The 10 highest case rates were in households that had cars. 57% had cars. The lowest case rates, only 1 out of 5 had cars. So again, the statistics just don't seem to be bearing it out. The 10 highest case rates, 53% were transit users. The lowest 10, 55% transit usage. When we started looking at the suburbs, which have no subways, we found every New York suburb around New York City had a higher case rate than New York City. If you look at the top, New York City, during this peak period up to June 16th, 2020, had 2,550 cases per 100,000. Rockland had more, Westchester had more, Nassau, Orange, Suffolk, Passaic, even in New Jersey, Passaic, Union, Hudson, Essex a little less, and Bergen a little less. And in fact, Bergen has a higher transit usage than the other counties that are there. So one would have expected the opposite if the subways were contributing, but these areas had no subways. So what's going on here? The other part of that equation is, it's an unfortunate one. On one hand, we hailed our heroes. We said, you guys are wonderful. You came out, you're driving our buses and our trains for our essential workers that have to get there. You are picking us up in ambulances. You're working behind the counter at grocery stores. You're even coming to our cars and testing us. You're delivering our packages. You're making sure we get our medicines. You guys are wonderful. And at 7 o'clock at night, people would be clamoring, making noise, saluting our heroes. But on one hand, we salute them. On the other hand, we discriminate against them. Right in the same exact moment that we're cheering these people on, we are saying we're going to discriminate against them. We're going to cut the service that they rely on, public transit. The New York Stock Exchange had the nerve to say if you took the subway to work, you could not work on the floor of the New York Stock Exchange. If you came by car, you could. The CDC told companies like mine, encourage your people to drive and encourage them to drive alone without any evidence, and we cut service. How did this happen? Irresponsible research and reporting. I take it a fair number of you have taken Statistics 101. And in Statistics 101, they often show you the curve on the right, that ice cream sales and drowning incidents on a time basis, month of the year, correlate very nicely. So does that mean eating ice cream leads to drowning? You know, so be careful eating ice cream. No, obviously not. And that's what the MIT researchers, the Wall Street Journal researchers, and the others forgot. Statistics 101. New York has so many reasons why we were first and it wasn't the subways. We're an international city. We're a hub where people come from all over. And of course, New York City, when it's going to be a worldwide pandemic, will suddenly be an epicenter. It's not because of the subways in this particular case on it. I was yelling at the stock exchange, I was yelling at the New York Times, and they changed. But you could see the first stories were cars protecting LA, subway seeded the virus. By August of 2020, is the subway risky? It may be safer than you think. I helped prod that story, but it didn't get out much attention on that. California, which was the land that the car was supposed to protect people from COVID, had, I don't mean this to gloat, had the most deaths and probably still has the most deaths from COVID. We also interviewed virologists, epidemiologists, and other health scientists from the United States, but also around the world. It's just a sampling from Paris. Remember, this is the first few months of the outbreak. Vienna, Tokyo, Hong Kong, Seoul, Singapore, Milan. We deliberately went to places where people rode transit in large numbers. They could not find anything there. And what were the reasons that they gave us? People on the subway don't talk very much. And by the way, I want you to wear your masks on the subway anyhow, but there's very little talking. And if you're just breathing, by the way, right now the particles from me are going 8 feet, 10 feet. So, but if you're just sitting there and you're breathing and you have a mask on, very few particles are getting beyond that mask, and you're not getting, other people aren't sharing their particles with you. It's also the ventilation system on the subways is actually quite good, and I'll go over that briefly. And you're there for a short duration. So it's an airborne disease. The other thing we found is fomites, the surfaces, was not a significant way of transmission. I know we were cleaning everything in the very beginning because we didn't know, but it looks like it's really only airborne, and only if, I don't know, not that it can happen, it's so unlikely to be from touching something. The Center for Disease Control, along with the engineering society that regulates ventilation in airborne disease isolation rooms. These are rooms that are used for isolating the airborne spread of infectious diseases such as measles, chickenpox, tuberculosis. They recommend 12-time replacement of the air with 2 complete replacements of outdoor air. The New York City subways has more than the 12 times, it's 18 times an hour. The MERV filter, though, is not such a great filter. It was a MERV 7 when we did this report. I think they've upgraded it. But also, when the doors open, there's a tremendous replacement of air with some fresh air. So the subways tend to be safe. Again, wear your mask on the subways anyhow, no matter what I'm saying. Today, I wear it on the subway all the time. And classrooms are only 3 to 4 times an hour. So I just throw in airplane ventilation because, in case you're curious, they have really good ventilation systems because the ventilation comes from the ceiling down, and maybe you'll breathe some of the air from somebody behind you or in front, but not much further than 1 seat away. So if you're on a plane and it's got 300 people, you're not breathing the air of 300 people. You're breathing the air of just a couple of people. In Tokyo, they did, in Japan, they did exhaustive tracing. And Dr. Oshitani, who's a virologist at Tohoku University, said that he found it was at gyms, pubs, live music venues, where people gathered to eat and drink and chat and spread particles. He looked at Japan's heavily packed commuter trains, and he could not find clusters from that. So something's going on. The world thinks it's the subways, but it's not the subways. We then took a look at where we had the worst case rates. This was as of June 7th, 2021. So COVID had been with us for a year. If transit were a major factor, you would see some of the big cities being on this list. In the top 10, number 1 was Eagle Pass, Texas, which has no public transportation. Yuma, Arizona, Gallup, New Mexico, Bismarck, North Dakota, and so on. New York didn't make it into the top 10, didn't make it to the top 50, not even the top 100. New York was 105. I throw in Washington and San Francisco since they do have significant numbers of people riding transit. Again, they didn't make it to the top 100. They didn't even make it to the top 500 areas. So I could make the same mistake that those MIT and other scientists made and say, it's got to be cars that are causing COVID. It's not cars either. It's what you're doing, where you are, and your behavior there. And I do recommend wearing masks on transit. There's actually one study that found taxis and Ubers had a higher incidence than transit. Others have since done studies. Vital Strategies did one about the same time that we did. They found airborne diseases. They looked at a number of airborne diseases, and they could not. Here's the one where SARS was traced to taxis, but not buses and subways. Evidence of COVID-19 spread in mass transit vehicles is rare. NYU did a study at the end of December, finding no evidence of a relationship between transit ridership and airborne diseases. Tri-State Transportation Campaign looked at subway turnstile rates and could not find any correlation. I think the most important ones are on this page. Imperial College of London went to the London Tube and went to the busiest stations and captured air samples and surface samples, swabs, and could not find COVID traces, even during peak periods of COVID. And the University of Finland, which just came out last month, looked at numerous studies from around the world that came to the same conclusion we did 2 years ago. Current research shows no association between public transport and risk. So, especially for trains where the transportation risk is low. Despite that, if you speak to people, they will say, I'm not going to take transit. Well, crime now is taking center stage on transit, but people will also say, this was a questionnaire we did a year ago, 87% said transit will not be safe from viruses. And 80% at that time were talking about crime. And how does this pan out? We asked people what they're going to be doing 2 years from now. This was last year. And you can see they're going to ride public transportation less. They're going to drive more. They're going to walk and bike more. But they're going to be driving more. And we know that that's going to add greenhouse gases and other problems for us. This shows the different modes of transportation and how they got affected. The blue is the height of the pandemic, how low things got. At the airports, we were down to 2%, and the most recent data is 94%. And commuter rail got down to 3%, meaning 97% of the people were no longer there. Same thing with taxis. Subways got down to 8%. But you can see where we are today. Subways are at 65% and buses at 64%. The Ubers and the Lyfts are at 86%. Car traffic is at 100%. And trucks are at 109%. So if traffic is at 100%, but with more trucks in the mix, every truck has the equivalent on traffic of 2 to 3 times that of a car. So the result is traffic is worse than it's ever been, worse than it was certainly in 2019. So this is a big impact on our city, and it's the same pattern. I have that for lots of other cities that we're seeing. Traffic is worse, truck traffic is up as everybody wants to get deliveries. And if this continues, the fatality rate goes up. Number of people killed in transportation goes up. So cars, you're 20 times more likely to be involved in a fatal collision on a per mile basis in a car versus that of transit, although the last week or two has been awful. The next topic, by the way, I'll take questions at the end on all of these. You may have heard about congestion pricing and what's going on, and I've been intimately involved over the years. There's already a congestion charge for FHV, stands for for hire vehicles, meaning Ubers, Lyfts, taxis, Via at that time. If you're in Manhattan south of 96th Street, you're charged a flat rate extra of $2.75 for an Uber or Lyft, $2.50 for a taxi, 75 cents per shared ride. The Traffic Mobility Act was passed on April Fool's Day 2019, but it's a real act. It applies congestion pricing for Manhattan, the business district, the CBD, Central Business District, is defined as Manhattan south of Central Park or 60th Street. And that went into effect with a revenue goal of $15 billion, of which 4/5 goes to subways and buses, so $12 billion, and $3 billion for railroads. The fee, nobody knows the fee. You may have heard from $9 to $23. That was an environmental impact statement that was done, environmental review that was done by the MTA. We really won't know what the details are until after the election. It's deliberate. It's not accidental. Politicians always do things like that. So there are a few exemptions. The FDR Drive and the West Side Highway, which are the edge roads for through trips that don't stop in the Central Business District, vehicles transporting disabled people, and residents in the district with an income less than $60,000. And I put 3 question marks because so many people are asking for exemptions. The earliest date is late 2023, but chances are there'll be lawsuits and other things before, so it may not go into effect until after that. The equity issue always comes up. This is an old study. We're trying to update this, but this is from 2015, and you could see the income of people that drive is much higher than people who don't drive. People that have access to cars versus people who don't have access to cars. And even if it was $3,000 a year to drive, you could see there's a big skew. The Community Service Society found that the ratio of the working poor who would potentially pay congestion tolls is, there's a 38-to-1 ratio in terms of working poor who would benefit by this. And there aren't too many poor people that can afford to drive into Manhattan south of 60th Street, park their car south of 60th Street. The garage prices are $1,000 a month and could be $30 to $100 a day on it. So there aren't very many people, and those that do are low income are usually working night shifts. And the congestion pricing advocates are talking about breaks for the night shifts. But as part of this whole process, the city and the advocates called for low fares for low-income people, called fair fares, and that's half fare for low-income people, which is already done for seniors. So that has gone into effect. A lot of the brouhaha that you're hearing right now is this document called Executive Summary from Central Business District Tolling. It's a 4,000-page document. I believe the MTA didn't do itself a service by the way they unveiled this, because they came up with silly scenarios and came up with silly prices, and the most extreme always get covered. So when they say $23, that's what you keep hearing, $23. Nobody thinks it's going to be $23. But I want to deal with one issue, and that is, in their study, they said trucks will go through the Cross Bronx to avoid Midtown Manhattan. The reality is that's not likely to happen if the MTA is smart about how they're doing things, but you may say they haven't been smart until now. So I'd kind of show why we're not going to be sending trucks through the Bronx, because the price will be no different with congestion pricing, without congestion pricing, if we give a credit at the existing toll facilities on it. And the other part of that is we can also mitigate the impact by decking over and building parks in the area. I'm going to go rapidly through this because I want to get to the question and answer. But whoever I talk to, if it's the truckers, say it's the goddamn cars. If it's the car driver, they blame the trucks. They all blame the bicycles. The bicyclists blame the city workers and everybody. Nobody wants to pay, and this is a New Yorker cartoon of two dogs who would not be opposed to a cat tax. I'm going to run through autonomous vehicles quickly so we have time for questions, but I wrote a book on it, and the working title was Autonomous Vehicles, the Good, the Bad, the Ugly. The good is if we make them and integrate them with the transit system, so they are in fact transit vehicles. I mean, there's some that could be done for trucking and others, but in terms of urban systems, they should be integrated with transit. So many good things can happen with that. And if we don't, so many bad things can happen, and we could create an awful future for all of us. There's a lot of myths out there. One is that 94% of the crashes, fatal crashes, are due to driver error. Somebody once said that, and somehow it became a meme, and now everybody uses that. Nobody knows where it came from. It's not true. And still, the autonomous vehicle industry claims it's driver error. Sweden, somehow, without autonomous vehicles, has been able to reduce their fatality rate to about a quarter of what ours is. So you could save lots of lives without autonomous vehicles. In Oslo, a city of 673,000, had in 2019 no pedestrian fatalities, no bicycle fatalities. One car went off the road and crashed into a fence, and that was the only fatality where you could see New York City has 218 in 2021, 273, and we're probably going to have about the same number. So cities around Europe in particular and Asia have a much, much lower fatality rate. It can be done without autonomous vehicles. And what autonomous vehicles are saying there, we don't know how safe they are. This is some data, and I presented this at autonomous vehicle conferences. If the Waymo gets into a crash every 62,000 miles, and the only reason we know that is because there was only one state that requires crash data to be reported. Waymo in Phoenix, Arizona says it gets into a crash every 127,000 miles. Cruise gets into a crash every 38,000 miles. The average driver gets into a crash every 500, or 500,000 miles almost. So we're not quite there yet. Will we get better? Absolutely, but right now the industry is not sharing information. We don't know how many people have been killed, and there is no central repository of serious crashes and fatalities. I'm hoping that we get more on that. If you take a look at the autopilot warnings, Tesla's been singled out for misleading people. But even if you look at all the situations that they say could make autopilot not work properly, they also put down it may do the wrong thing at the worst time. So if your computer ever froze on you, imagine your computer is carrying you at 70 miles an hour and it freezes. And that's all an autonomous vehicle is. It's a computer that moves very, very fast with all sorts of devices that try to detect things. And there are detection systems that are being developed. Not quite there, but FCW, forward collision warning with auto brake, is very promising, but what I'm about to show you is a bit disappointing as to where we are today with it. All these vehicles have advanced collision warning systems. And those were done a couple of years ago. This is done this year. A cyclist. There was a vehicle crossing over. So you can see we've got a ways to go. A lot of these things will be perfected, but these were at low speed, not at high speed. And at night they were all ineffective. Encouraging active transportation. I'll just go through rethinking our streets. And again, I want to get to the questions and answers. This is a pet project of mine to build pedestrian bike bridges to Manhattan. We haven't built a bridge to Manhattan Central Business District since 1909. It is time. And one thing that I saw this saying, streets are saying things on a lamppost in Chelsea, and I took a picture of it, and I thought about it. It's either someone who's paranoid or someone who made a very profound statement. And for me, it's a profound statement that the streets are saying things. When I travel to other cities, right away I know if it's a walking city, if it's a friendly city, if it's a city that I'm going to enjoy without having to sit behind the wheel of a car. So the streets are saying things. I was here for the first time in many years at Hillel Place just now, waiting, and I could see part of the street has been closed off. And that street is saying things. People were getting together and they were talking, and there was a healthier environment there. So the streets are saying things. Walkers are the oxygen of cities. So many benefits, increasing romantic opportunities. I throw there because I met my wife walking my dog in Prospect Park. And these are my books. And thank you very much, and happy to take any questions.
So I have a question regarding congestion pricing and the whole concept behind it, because this is not a new concept. It's been well, at least from my limited knowledge, it's been happening in other cities across the world for years, and with different models, including models where you have even an odd numbered plates, where one gun is allowed one day and one is not allowed the other. My question is, what have we learned from the lessons of other countries that have instituted such a model in large congestion cities?
Yeah, congestion pricing, the concept was conceived here in New York City. William Vickery taught at Columbia University, a professor of economics, later went on to win the Nobel Prize in economics, but you have to be alive to win the Nobel Prize. Sadly, he died 3 days later, but at least he lived long enough to get the Nobel Prize. But he used to pester me when I was a city official to introduce congestion pricing. So I always hoped we would be the first to do it in the Western world. Singapore had done it in 1975. London was the first Western city to do it. And it's been incredibly successful. Stockholm followed, Milan followed. I understand Bogota is about to do it, and about a dozen cities now have congestion pricing, none in the United States on it. So what we learned from London, what London did, which was very good, is they bought lots of transit prior to the implementation. So transit got immediately better. The traffic volumes went down by around 15%, and London said, let's take advantage of that by widening some of our plazas, putting in bike lanes, putting in bus lanes. So the speeds are about the same as they were back in 2003, now 19 years later. The zone itself has expanded, and they've also thrown in another dimension on vehicles that pollute a lot, have an extra fee. No city that put in congestion pricing has taken it out. Stockholm put it in. There was such a battle over it in Stockholm. They decided, we'll put it in for 6 months and then take it out. And, vote for it or afterwards. And it went in for 6 months. Prior to the 6 months, the majority of people didn't want it. After the 6 months, the majority of people voted for it. So generally, it follows a certain pattern. 85% of the people do what they always did before. 15% or so do something different. It could be they drive around the zone. It could be that they double up in cars, so the cost is reduced. They may switch to transit. They may change their time of day. But it's not as dramatic as people think it will be. And it won't be that way in New York. But there is another curve that in the congestion pricing literature shows there is support for it. And once it's getting close to being real, suddenly that support wanes and people are opposing it. And we're on that curve right now when people are taking shots at congestion pricing. I met with that congressman from the South Bronx, and that's why I showed that, and I showed that to him. And I said, we're not going to let the South Bronx be overrun. The New York Times in particular has been unhelpful, ran 2 stories at least that I thought were not smart, and one was on the Bronx. And I tried talking to the reporter. She had called me, and then she said, no, I don't want to, I got enough information. I kept sending her information. She ignored it. And the second story, same reporter. So she did one on the South Bronx, which implied that the wealthy people are going to shift their congestion and pollution burden to the poor people. That was the message. Again, people of color are going to suffer, and rich white people will not. And it's not true, but that's what the story was. The one that came out last week was that yellow taxis, and as you introduced me, I drove a cab while I was at Brooklyn College, and even afterwards when I was looking for a job. They wrote that cabs may suddenly, the cab industry will be destroyed if they're suddenly charged $23 to pick up a passenger. Advocates have talked for many years that yellow taxis have been here. They've been here for a long time. They're part of the public transit system. They should not be subjected to an additional charge. So none of that made it. So we're in a pretty tough position right now. There will be a lawsuit or lawsuits. I was sued in 1980 when I tried to do this. I've been at this for a long time, and it's still a little tough road ahead.
Professor Cantel.
Sorry. Thank you so much for it was so interesting. So I have sort of a question and a comment. One question is that it seems that the New York Times and other newspapers were really detrimental in terms of what was happening in the pandemic, and it made the ridership even go down with all those papers. So is there a possibility of what people are doing now to change that narrative? Because it seems like it really hasn't helped MPI and whatnot. And if people like you can even support more to change that narrative. And the other is more, I guess, philosophical in a way, because it's related to the politics, right? When you comment about Europe, it's more social democracies, which always look for everyone. So, I mean, it's sort of obvious that public transportation is going to be, but how are you going to do it here in this country under all?
You know, it's really hard. I've been trying to change the narrative, but basically, and anytime I'm interviewed by the media, I throw it in that subways are not vectors of COVID, and that part gets cut out. So it's rarely there. The New York Times did not cover our report. The Wall Street Journal did a pretty good job of it, and a couple of other papers. But editors have things in their minds as to what their readers will like. You bring up the difference in Europe. It reminds me of a talk I gave in Brussels about 6 or 7 years ago. It was a transportation and urban planning group called POTUS, not POTUS, no, POLIS. POTUS is the president. And it was a 3-day conference, and I spent a lot of time listening to many of the planners representing European cities. And then I got up and I spoke, and somebody asked a question, which was one I hadn't encountered before, and said, what do you see as the difference between European planning and American planning? I was the only American at that conference. And I thought for a moment, and I remembered all the conferences, all the sessions that I went to, and I said, you believe in science. I said, when I go out into a community and I'm trying to convince a community to change behavior or something like that, I know what the audience is thinking, what's in it for me. I have to think about the economics. I open with the economics, how this will be economically beneficial, or if you don't do it, it's economically detrimental. The science in the United States doesn't work as well as it does in Europe. It's a sad statement to make, but anyway, you could change the narrative, and others, and speaking to students, and they can keep that up, that would be wonderful.
In the second row?
I was going to ask a similar or related question, I guess, which is, how do you find that the community engagement process works better in different places than here? How could we improve our community engagement process? Because I feel like, obviously, engineering and science are part of the solution, but I don't know, like Department of Transportation is opaque, and they occasionally have a thing here or there, and it doesn't ever seem to add up. I went to a BQE one last night, so it's fresh in my mind.
Oh yeah, that's a big one.
But if you know of the planning processes in other countries, are there good benchmarks or examples that maybe we could implement here?
Again, it's the benefits. I think when it comes to, the BQE, the DOT activated that community by coming up with a ridiculous plan.
Sounds like a good way to do it.
Building it as if it was a Texas highway, building it alongside the promenade, which, I thought it was a joke the first time somebody said it to me. I said, nobody in New York would come up with that. So the DOT has its own, problems, but as you were asking about that, I've spoken to lots of groups around the United States, and I've had clients in many different states. And I remember hitting upon one thing in a place called Arcadia, California. And the person, my client, was Rick Caruso, who's now running for mayor of Los Angeles. And this has to be 17 years ago or something like that. It was a long time ago. And he had an idea for the Santa Anita racetrack to build mixed-use development. It's like Brooklyn, right? There are stores, people live on top of stores, there are apartment buildings, they're on top of stores, people walk. There's a lot of things that happen. Where I grew up in Bensonhurst, my father had the little grocery store, next door was the fruit store, the next door to that was the butcher, the liquor store, and so on that. And so he wanted to build an urban environment in a suburb. And they went nuts. They absolutely freaked out. But the one thing that seemed to get them, I started talking about their children. And their children would hang out in the mall, pretty far away. And I told them, if you want to keep your children, if you want your children to stay, when they want to leave home, not to leave Arcadia and go hundreds of miles away or thousands of miles away, build environments that they will enjoy. So that was the one thing that got their attention on it. It's a tough sell going into any community. And we didn't win, we won that one battle, then we lost the bigger battle on that. But I've been through many different battles. It's pretty tough. In New York, I've often said, if God came down and offered the Garden of Eden, groups would come out and protest. Peter would come out and say the serpent is really not a villain here or something like that.
Professor Saxon?
So hi, part of the problem I think is the cost. Public transport in the United States is very costly, and if you even consider the tri-state area coming from New Jersey or Connecticut to New York, its car is more cheaper than whatever NJ Transit or so. Unless that economically beneficial to the community is not going to react the way we want to have the climate change and all our environment to be for the next generation. So I think I know,
Yeah.
you will do it.
Yeah, well, you hit upon it, and yeah, transit is too costly for lots of people. And yesterday I was meeting a client at Kennedy Airport, and I took the railroad on the senior pass, and it was $10.50 to just go to Kennedy and back. And that was on the cheap side because I'm a senior on it. And then I had to pay $8 to take the air train both ways, $16. So that whole thing was like about $40. The idea of congestion pricing is to be a bit of an equalizer to that. So driving a car will be a bit more expensive. Transit will have an infusion of $15 billion to improve the transit system. We pay through the fare box higher than most other cities pay through the fare box, although COVID is changing all of that, and we're in trouble in a year or two because there has been a lot of federal support for transit. But we can't live without our transit system. We're not New York City without it.
I think we have time for one more question. Professor Menser?
Thanks. Fantastic talk. Really appreciate it. And I was going to say a similar thing, which was the bus was free about a year and a half ago, right, during COVID in New York City. And there are many cities right now in Europe, and Berlin probably the most noted recently, that made it free because of the whole situation on fuel costs. But when you make something free, people do tend to use it more, and that would certainly be the case in New York City, I would think. That would also seem to predicate dedicated bus lanes for the buses, which then would also displace cars. So, and also vis-a-vis climate change and inundation events and flood events, buses have certain kinds of advantages over things beneath the ground. So I'm wondering, do you see, and this administration, the mayor's report just came out, they're very behind on the dedicated bus lanes and on express lanes. And so that's one, it seems to be a fairly doable part that New York City could make headway on. Corey Johnson was really big on this. He had this whole plan. He was supposed to run for mayor. He ended up not running for mayor. He would have been, I think, maybe the first really transit positive mayor in terms of vision. And it gets into the governance and engagement things. Oh, absolutely. Bogota, Medellin, Taipei, Madrid, all had great planning processes that brought a lot more walkable spaces and so on. There's lots of examples of this. But I'm curious about the bus stuff in New York. How do you think of that? Could that be a place to lose more support around it?
I did have a meeting with the head of the MTA, I'd say about 2 months ago, on congestion pricing. And I said, one of the ideas, we had a different plan. It was called Move New York years ago. We went around when nobody was supporting congestion pricing, just about. And we said separate the bus from the subways, make the bus fare lower. We didn't say free, but we said make it lower because it's a different transportation experience. It's a much shorter distance in general than the subway on it. So yeah, I've been supportive of that. The idea of making it totally free and saying transit is a service as opposed to something you have to pay for is something that there is a little bit of support. There was a fellow named Theodore Kiel that did a whole study on it and found it incredibly beneficial to the city to do it. The problem is when it comes to transit, the way the budget people view things, they call money for transit a subsidy. They call money for roads an investment. So it's a pejorative when you call it a subsidy and when you call it an investment. So most money, public money, goes to building more roads, wider roads, more bridges, and for cars and not for transit. It's embarrassing. We don't have high-speed train here in the United States. You can go, and high-speed trains have been around. I took a high-speed train in Japan, I'd say 35 years ago. And here we're like futzing around with a Hyperloop. When the technology of just tracks is already there.
So, I would like to invite everyone to the Kimmick Reading Room, also known as the Lily Pond Room, which is just right around the corner when you leave this room. But before that, I want to thank Sam for a really interesting talk, and I hope we can